Welcome to the program Health and Beyond. In this program, we have up-close interviews with professionals in the health sector to enlighten communities on health-related issues as well as other topical issues beyond health. The program comes face-to-face with people who have valuable information for public consumption. It's once again a delight to be in your midst today. The program Health and Beyond is here with you. For presentation, I am Clementina Njang-Young. Every June 12 is commemorated internationally as the World Day Against Child Labor. The day serves to raise global awareness of the mental and physical harm endured by children forced into labor, acting as a catalyst to eradicate this practice. Our topic for this program is child labor and health. To dissect this topic for us are two specialists whom I would love for them to start with self-introduction. To my left is
Yemlu Napoleon Gaffey.
Dr. Yemlu Napoleon Gaffey is a Cameroonian and a medical doctor. He earns a diploma in pediatric foundation from the University of British Columbia. He is currently serving with the Quen Baptist Hospital Pediatric Department. He is the founder of Children Medicine, a consultancy service that seeks to educate parents, adolescents, and children about medical conditions and their preventive solutions. He is a Christian with a passion to see everyone live healthy and sound to fulfill their God-given purpose. I love the part where he says he is a Christian. To my right is
Sono Josephine, alias Josepel.
Wow.
Alias Josepel. Sono Josephine is also a Cameroonian activist focused on gender and child protection. What she does? Her role as a gender and child protection supervisor at the Cameroon Baptist Convention, CBC Health Services, is to supervise all issues around gender and child protection. Focus is on building capacity in child protection plus safeguarding in programs and institutions, especially in humanitarian settings. Her experience, she has 10 years and above supporting sexual and gender-based violence, otherwise known as SGBV, survivors through various organizations. She's worked with UNFPA on maternal, newborn, and adolescent health, and with UNICEF in Kumbu and child protection, GBV, and socioeconomic empowerment of persons with disabilities. She does a lot of advocacy work. She pushes for inclusive SGBV policies so survivors get timely support. Recently, she co-authored research on GBV against women with disabilities in conflict-affected Northwest region of Cameroon. She also trains MIL and M&E teams on household participation, governance, and civic rights. As we can see, we have two specialists here, and they have very rich profiles to handle this topic today. So tell us, how are you feeling today? How is the family?
Very well. I feel elated being on the program, and by the grace of God, family is doing quite well.
Thank you very much. And Dr. Napoleon?
Well, I'm always feeling happy anytime I have an opportunity to talk about things related to children, their physical and mental and social well-being. In fact, I've been waiting for this moment.
Thank you very much. We are going to start right away by trying to define some of the terms that we have in our topic today. We are talking about child labor. But before we begin, who is a child?
Thank you very much. The UN Convention on the Rights of the Child, the African Charter on the Right and Well-being of the Child, and the Cameroon Penal Code all define a child as that human being or every human being below the age 18. The UN Convention gives some other clause For some other countries, majority is attained at 16. But in Cameroon, we're talking about the human being below the age 18.
And Doc?
Yes, I think the stress is on the age of the child, regardless of your economic, social, or educational background. Any human being below the age of 18 is considered a child in Cameroon.
And then now getting into labor and by extension child labor.
The International Labour Organization defines labor as any hazardous work, whether it's economic activity, is domestic work by any child that is harmful to their health. It's keeping them away from their education and has some negative impact on their development. Children are expected to work to do light work, but children must not work beyond 14 hours in a day. Work could be washing plates, doing some chores in the house, but anything that will impair the health, the schooling, and the of children is called child labor.
Yes, and even when we are talking about this child labor, you have explicitly talked about some of these activities that are undertaken by children. I suppose maybe, Doc, you have other activities that children do as a pediatric person.
Yeah. Generally speaking, we have all grown into adulthood.
Yes.
Responsible adults, because we had some work, like basic work to do that could help us to become who we are becoming. But there is the exploitative part of it, which Madame Sono has defined as child labor, where a child, instead of bringing the best in the child is rather, made to become worse and all of those things. So some of the activities that can make the child, or that can make us term it a child labor, there are many of them. For example, in agriculture, if a child is given insecticide to spray, the system is not that effective. You can spray,
and it's common nowadays, especially as people use insecticides to spray even grass.
Yeah. So long hours of farming, a child wakes up in the farm, walk the whole day under rain, under sun, under cold the whole day, and then comes back tired. Especially even in school periods when their friends are in class studying. So you see, the child is losing academic time for work. Carrying heavy machineries, heavy loads, hawking on the street in the rain. It's common these days to see very little children climbing, buses to advertise things, to sell, and so on and so forth. Any activity given to a child above his carrying capability is termed child labor. There can be many of them.
There can be many. I can identify myself even with so many of them that you've already enumerated.
Yeah.
And I would like to find out now if at all there is a law in Cameroon that talks about child labor. So what does the law say about child labor? Is it a crime?
Okay, before I get to what the law says, let me go back to the definition of child labor to add some little bits. Minimum age for work in Cameroon is 14.
Yes.
Okay.
So there are some nuances that we've been struggling with, and we've been looking forward to harmonization of who a child is.
Yes.
Defining who a child is and what should constitute who a child is. Because when we talk about safeguarding the rights of the child, or we talk about protecting the child, we want to be holistic. There are different ages for when a child can get into marriage. There are different ages for when a child can start working. So minimum age for work in Cameroon is 14. The other thing is hazardous work. Work in chantiers, work in nightclubs, selling in restaurants, in bars, and things like that is 18. So there's another discrepancy at that level. And then working in industrial settings, the child must not work beyond 8 hours. Even though a child could work less than 14 hours, like just said, but not beyond 8 hours when it comes to industrial work. Now, when we look at the laws that punish child labor, we have the Labor Code, Section 86. The order number 17 on child labor. It sets out the minimum age and hazardous age, just like we have said. And then there's Article 9 to 23 that lay down the rules when it comes to child labor. The punishment violation for child labor include fines.
Okay.
They might also go to other things, but the labor inspectors can take direct legal action before court under Article 109 of the Labor Code. Looking at the Penal Code, I've just mentioned the Labor Code. The Penal Code on Article 11, Section 342, subsection 1, Section 352 to 353, they all cover prohibition of hazardous work in all its forms. It doesn't matter what. Now, Articles 352 right down to 354 also touch on commercial sex exploitation of children, which is something very concerning in our context. For prostitution, procuring prostitutes or sharing profits, which means fine plus 6 months to 5 years prison, doubled if the person is below 21. So this is what the Penal Code tells us. And then there are also laws relating to trafficking in person, especially trafficking in children. We have Section 2, 4 to 6, which prohibit child trafficking. But now there's a gap. Since 2024, there's a gap that trafficking law requires threatened, forced, or coerced. Those are three concepts to watch out. So you will find children who have been trafficked or smuggled from maybe in Kambe, from Donga Mantung to Bamenda, and they are into domestic housework that has been defined as we have seen, that are into different kinds of child labor interns. But now if threatened, forced, coerced, doesn't fit in their context, it will not fall under child labor. So this is the nuance or the gap that we are looking at.
Thank you very much for bringing out that clarification. She's talked about hazardous work.
Yeah.
In your own opinion, what would we consider hazardous in the context of Cameroon?
Okay. So I'll first begin with the physical hazards that the child can be exposed to. I began to mention in agriculture about giving the child insecticide to spray could lead to all kinds of inhaled toxins to hamper the child's health. What can be considered hazardous? The child does not reason on his own. A child depends on what he or she sees, hears, in order to form his or her mindset.
Exactly.
If a child's mindset is damaged, that child, in fact, there can be no, in fact, the hope for that child is at stake. What do I mean? If a child, for example, is forced into labor, he has the picture that the world is a bad place. The world is a difficult place. The world is not for people like us. In fact, we're just created to suffer for the sake of other people.
Yes.
If a child is, sexually exploited, what kind of picture does that child come up with? He's emotionally damaged. He's psychologically, disturbed. So you see children who cannot even concentrate. You see children who cannot even, perform well in school. They are just in a wall of their own because a lot of harm have been done to their mental well-being. And these are things you may not just see easily on a child, but if you just get close to and find out what they have been through, it will be so dangerous. So physical, mental, emotional, children who have not grown up in homes that the parents have really loved them, giving them the care, the necessary care that the children need, abandon them to themselves, and so on and so forth. It can really be very hazardous to those children. And I think we have to watch out for those.
Thank you very much. You've actually made us to understand that there is a very high impact, especially to the well-being of children when it comes to child labor. I would like us also to look at what pushes parents and guardians to child labor cases. Who is responsible for promoting child labor? That is, we are looking at the socioeconomic roots driving families into exploitative labor in Cameroon.
Well, let me talk from the perspective of where I am based.
Okay.
Yes, the Northwest region. Unfortunately, we are in a protracted crisis that has left with, uh, let me say, long-lasting socioeconomic impacts on families because of displacements and repeated displacements, because of loss of homes, because of loss of livelihood, loss of sources of income, and things like that. So, these are some of the root causes for which children are found in child labor settings. You find a family that has been displaced and redisplaced because of the crisis. Take, for instance, they left Dongamanto, they left Bui, they left Menchum Valley, and they ran to safety, maybe in Douala, maybe in Bamenda, maybe in wherever they find themselves. And now the family needs to survive. They are maybe choked in one room, or they are in a host family. They need to. Now, some host families will take advantage of the vulnerability of the children because they need to survive. They'll do all the chores, they'll do all the sellings, they'll do all the hazardous kind of things that they need to do to survive. Some parents will push these children to go do these things in order to make ends meet. We've had children, young girls as young as 13, 14, that their parents are the ones telling them to go out. And they go and they get boyfriends, they get men. Some of them are forced into early marriage just so that they can survive. Now, there's the issue around access. Now, access means you need to go to the farm, you need to go to your job place, you need to go to somewhere. And because there is the warring faction, you need to negotiate access. And at times, the children will negotiate access. It's a bargaining. Some of them are unintentionally associating with the different factions in different ways, as maybe young boys and girls, maybe giving sex in exchange for access and freedom and many other things. So responsibility lies at, let me say, it's a collective responsibility. The government takes responsibility, the community takes responsibility, the parents take responsibility. Now, because they are children, we don't want to assign some level of responsibility to them, though they also have to be accountable and be duty conscious. So children have to know their duty while we are protecting their rights. They know their duty. I need to fetch water, I need to clean the house, I need to wash the dresses, I need to make up the bed, I need to go to school where it is applicable. So because schools had been, or education had been under attack in the context where we find ourselves, it radicalized children. That's why you see a lot of them being peer pressured into different conducts, issues, into drug addiction, into sexual. There are some young girls around that they have hookup groups. It's peer pressure. They join in order to be hooked to a guy. And lots of things are happening. Another one is they have some groups where they are there's a name that is given to them. It's like they are the mamas, or I don't know what area mamas, or some kind of name. They recruit you in there. Maybe you're selling some things on your status. They tell you, well, you don't have money, come to our group. We are going to give you much money, make sure you have much money, and you're selling. And the condition is that you recruit more. And it's a very deadly group. And so many of them are getting into it. So child labor has to do with also sexual exploitation. That's why I bring up this aspect of it. Because lots of them are being hooked and given to men in exchange for sex and commercial sex. That's what I'm looking at.
Yeah.
Thank you very much. You've already touched part of one of our questions, which was to be how child labor is related to child abuse. I'm sure we'll still get back to that so that
Sure.
we can get more information about that. And Doc, she has talked a lot about the context within the Northwest region. Let me say by extension the Southwest region. Those are the two regions that are affected. But we would understand that in Cameroon, all our regions are affected as well. I would like you to now talk globally. She has painted the socio-economic impact that is affecting families in the Northwest and the Southwest regions. So what would you say are some of the reasons why families in other parts of Cameroon have their children do this?
Ignorance is one of the highest causes of child labor, I would say. There's a direct relationship between education and a healthy community. Parents who are not educated, who don't know the value of bringing in the values of children, can subject the children into forced labor, in fact, without even knowing, even abuse. Take, for instance, or a family, a couple who have the one I recently saw, a family who has 8 children, for instance. The father has a small shop and the mother struggles with just farm work. Unfortunately, 3 of those 8 children are sick of chronic illness. They talk about sickle cell disease. I don't know if they've ever heard about family planning, but to them, it feels like that is the norm in their community to have many children. And so the eldest child has struggled to reach the university level, but the rest, since the parents have exhausted all the resources to send the children to the first child to the university, the rest have no place to go. And so they are forced to go to the farm, they are forced to hawk in the street, and some of them, in the course of working, they get into the sickle cell crisis. They come to the hospital, there's no bills to be paid. So you see a chain reaction from the root cause of ignorance. When parents don't understand that...
Ignorance and hardship, I would say.
Well, yes. Ignorance, hardship, poverty, all together. You know, once you don't understand that, in fact, just ask yourself basic questions. These children I'm delivering, will I be able to take care of them given the circumstances we find ourselves in, and so on and so forth? So if children are not able to answer those basic questions, they'll keep on pumping children in the world without a backup plan, without a plan to take care of them.
Well, I think this aspect that you're just raising, it goes back to one of the things we have been fighting for, gender equity.
Gender equity.
Now, the responsibility might not necessarily be on the mother who is birthing the children, because she only carries
the child.
It rests to some point when you look at patriarchal structures on the man. We have grown up in a socialization context where we are told when you have more children, you have wealth, you have a strong force to work the farm, labor force. You know, those kinds of things, and you are seen as a man.
You're respected in the community.
So those are some of the things.
Yes.
So it's not only poverty like you're looking at. It's not only ignorance, but it's also that socialization aspect and patriarchal undertones that we need to really just challenge by empowering men and women to have this education so that they can understand that you can space your children and make sure that your limited resources can be able to adequately meet the needs of these children to be able to have a good education and to be able to subsequently support you, because the fear of not having a lot pushes them to have many children. Thinking that it will be a strong level force for them. So that there is need to unlearn what we have learned through socialization, relearn, and learn what is necessary for the family in context.
Are you, by extension, supporting or being against the statement that the empowerment of women actually results in the reduction of child labor cases?
Okay,
what would you say?
This is kind of tricky.
Yes.
Yes, when we empower women, when we empower children, I don't want to talk just about,
About women,
women.
yeah.
When we empower children with education, that's the major tool we've given, let me say, a nation. Because once a child is educated, a child is able to make informed decisions and choices.
Yes.
A child would tell assertively, no, I'm not going to take drugs because I know the damage of it on my health and those around me. I'm not going to go into prostitution because, no, I can push sex to the corner, achieve my purpose and my goals in life, and then get into sex when I want to.
Ready, yes.
Not because a peer pressurizes me, not because the circumstances around me will push me into getting into this. You see, so education is that a tool that can cause any individual, be it a boy or a girl, a man or a woman, to be able to make informed choices. And so this is why, yes, empowering a woman or empowering children is a tool to reducing the prevalences of child death.
Exactly.
Yes. And now we get back to the question we mentioned earlier. How is child labor related to child abuse?
Child labor is a very is the worst state of abusing a child. Child labor means there is a disconnect between the child's developmental age and the child's physical age.
Yeah.
Take a child who carries a 20 liters gallon of water, who is about 8, someone not, maybe 8'10",
Yeah.
and the distance from where they fetch the water to the home,
The house, yes.
the child has to carry, at times you meet the child's neck is getting inside.
Yeah.
We have children who have left Mendankwe in Bamenda, and they carry wood, they carry Irish potatoes,
yeah.
from Mendankwe around the palace,
right up
to Commercial Avenue to sell on foot. You see, so that's child labor. We have some children that we have talked with; their necks are never coming out. This is because they have overcarried load. So it is abusive because, like I said in the definition, it keeps the child out of school. It impairs their health, and it also impairs their development. 3 key things. So child labor is directly related to child abuse. We have already established that children should work, but they should do light work that is commensurate to their developmental ages.
Exactly.
Yeah.
Yes, thank you very much. When you were sharing this, I tell you, I spoke with an elderly woman. It's not a very long time ago, and I became teary. Teary, why? Because she shared her experience. She had shaved her hair, and then her hair is not, it's deep in the middle. So she tells me it's because she carried so many things when she was young. When she was going to the farm and carrying a lot of load, the amount of work that she was doing at home, to the extent that she says she had a relative, an aunt, who always hit her also in the middle of the head. And she says, okay, sharing this experience, it's by God's grace that she is still alive. That takes us to our next question as to how the future of children who have undergone child labor can be shaped by these experiences of the past.
Yes. Life is lived forward, but understood backwards. What the child has experienced in his or her life can have a very big role to play on the way he views society, lives his life, and contributes to nation building. First, I would say children, when they grow up, or children who have been abused or given child labor when they were still children, when they grow up, they tend to do the same for their children or even other children.
Yes.
Just like you were sharing this story, I also have in fact, he's not a man of God, but before he could really convert to be, in his right and balanced mind, he
took a
cruel.
lot of time. Okay.
In fact, he took a lot of time. He was cruel. He used to just he treats everybody the way he was treated when he was a child. He actually states that there was nothing he did that was right. He carries water, he's beaten. He doesn't carry water, he's beaten.
Oh.
You mop the floor, you are beaten. You don't mop the floor, you are beaten. So he was just a confused boy when he was growing up. And so he was like trying to put this same thing to others. Now, he was trying to balance discipline with child upbringing, but it was so difficult because he was still putting himself in the shoes of those children. And so it took the grace of God for him to kind of balance it. Even up to now, he's still trying. So I'm saying retaliation, to pass on that same treatment to others is likely when children who have experienced those circumstances in their childhood. Secondly, when they have also been put into those kind of circumstances, they grow up, with low self-esteem. Yes. If you cannot have you cannot view yourself as an important personality, you will not be able to do anything important to others. You will not be able to, you're always feeling like you are always wrong. You're feeling like there is nothing I can really do. Somebody told me that it's like God was creating the monkey before it turned out to be him. Whether God want to create a monkey or he cannot have him, because he was look at himself like he's not worth. In fact, so that kind of mindset cannot transform society. You need to be. You need to have a good self-image, a good self-esteem if you can be able to contribute to society. Children who have gone through, child abuse, in fact, even physically, yes, they are not healthy. Madam Sona talk about necks being down. We talk about the front, the deformation of the head, and so on. There are children who are, living in chronic illnesses, not because they would have had it, but because they acquired it through the labor.
Yeah,
and so,
preventable.
if you are not healthy, what can you do? In fact, if health is lost, in fact, somebody says that if someone who is not healthy has 1,000 problems, but if you are not healthy, if you fall sick, you have just one problem: to get well.
Yeah.
And so,
the fact is that most of the children do not even know that they are into child labor.
No,
yes.
There's the aspect of ignorance.
Yes.
And I find it so challenging coming to terms with the fact that we consistently grow and socialize in not letting our children know who they are, where they are coming from, and where they are headed.
Yes.
This is something that I talk to children, especially I use the church. I am familiar with the church. And when I'm talking to children in the church, I start from, who are you? You need to know yourself. What is your background? Where are you coming from? Now, who do you want to become in life? This is how I help children in career orientation, in choosing their friends, in choosing life. Whatever they want to choose. So it's a burden that parents consistently ignore the fact that children have a right to know. Right to know who they are, who know that they are made in this bodily form. That there's the other aspect of deviation, or I'll say people who have lost it. I'm sorry, that's how I say it. Who think that they are living in a body that is not the body they were supposed to live in.
They were living in.
Yeah.
So children have to know that I am Josephine. I am a girl. I am born in the likeness of God. That is how He has formed me. That is how He has made me. That is how He has shaped me. So as I'm growing as a little girl, I'm going to develop breasts as I grow up into puberty. And I'm going to have the potential when I grow older to make children. Because I have a womb and I can get pregnant. And so if I, by chance, have sexual intercourse or rapport with an opposite sex, I can be compromised.
This is what is
pregnant.
going to happen.
This is what is going to happen.
Yes.
I can have sexually transmissible diseases. I can have, this is what can happen. And the Bible even says that you take the spirit of this other person and add into into you. So lots and lots of things can happen. It's a ramification. So parents should be able to give what I call comprehensive education to children, to be able to know that even as you're growing up, this is hazardous. This is going to impair XYZ, your health. this kind of level, this kind of activity. It's not only child level. This kind of thing will put you in this place. So if you're this person and you want to become XYZ, this is what you should be doing. This is what you should be doing. This is what you should be doing. These are the kinds of person you should associate with. These are the kinds of books you should read. These are the kinds of, this is the kind of education that we fail to give our children. And they find themselves unable to say no.
Especially in the virtual world. Now, these are the kinds of things I should do when I am online. Because these are the people who are online even the most.
Exactly.
I'd like us to get into the theme of this year, Josephine. It is red card to child labor, fair play for children, decent work for adults. What does fair play for children and decent work for adults
Fair play,
refer to?
decent work for adults. Fair play, decent work. So I will say it's looking at the child's chronological age and the ability to work and matching it together. We should not subject children to what is above them to carry. So let it be fair. It should not, in fact,
It's like a message to all the parents, especially this holiday.
There is a balance. There should be a balance. There are some children or there are parents who say that, no, I don't want my child to touch a pin. I don't want my child to do this. I don't want my child to do this. It's the other side of it also. Your child needs some basic work that will help him to grow up to become the best person in society, but not the extreme, not the one that will be termed that everybody will just see that this is an abuse. This is hazardous for the child. So it should be balanced.
And by your child, we are referring to every child living in your home.
Exactly.
We're not talking about your biological child.
Exactly.
Because there are some parents who think, okay, this cannot be done by my biological child, but there are other children that should be done by the other child.
Yeah.
Josephine, I'd like you to
Thank you
contribute
very
to
much.
this.
When I look at fair play for every child, I'm looking at equity. Now, if a child is in the home, like we are taking the example, and is contributing to cleaning the house, is contributing to everything in the house, that child should have equity in access to education, equity in eating the food or the ration that is available, equity in being clothed. Not looking at, these are my biological children, these are not my biological children, but the other children are working. And then when it comes to access and benefiting to available resources, the other children don't have a fair. It translates also into work that we are looking at. Children do the work. They should also have pay for the work that they have done. Don't now pay adults higher when children have done equal work, like
you pay them less,
and you pay them less. And this is what happens in shanties and in other places.
And even during holidays when children pick up holiday jobs.
Exactly. So this is how I see it. Equity in access to and benefit of available resources, be it at home, be it wherever they find themselves. Just like we're talking about decent work for adults. Yeah.
I would like us to look at how now we are talking to those who are concerned, like you just ended, the duty bearers, so to say, what they can put in place to ensure that children enjoy their childhood and parents are also able to raise these children stress-free.
I am an advocate for a Child Protection Act, for a Children's Act in Cameroon. Wherever I have the opportunity, I'll keep talking about it. We have a child protection policy. Unfortunately, this policy is accessible to a few people. It's not yet readily vulgarized and being implemented. I am privileged to have a copy, not even the final copy, because I have connections with the ministry. People who do not have access to it. But I'm looking forward to a day that we have a Child Protection Act. I cited a number of punishable laws, but those laws are encompassing within a penal code or the constitution or the labor code generally. They have not been brought to weighing it when it comes to children. I love the way when I go to the courts and there is a case on indecency to minor. I love the way the court people they pick the case. They will just, I don't need to stress or strain to get justice for these minors,
Yeah.
you see. But now, if there was a Child Protection Act, there will be lawyers that are trained on this. There will be courts. We have a children's court that their cases are heard at that level. This is the jurisdiction of the government. So we need the government's contribution in making sure that we have a Child Protection Act. In developing that, it's a joint responsibility. There are civil society organizations that are doing a lot of work. There are the faith-based organizations and other maybe schools. We come together, we put our heads together, and we have a Child Protection Act. That's at that level. There is the role of the community. The community should not turn a blind eye when they see children in hazardous work or associating with peers and maybe forced groups that is detrimental to their well-being, to their development, to their health. On the other hand, the greatest responsibility weighs on the parents.
Yeah.
Unfortunately, too, we have parents who are not available, either by death or something has separated them, maybe the crisis and all of that. I'm not talking about irresponsible parents who have abandoned their children, because if there was a Children's Act, there would be a punishable law, a section or article to parents who have abandoned their children and the grandmothers are struggling.
Yeah.
So these are the steps. These are the different levels of responsibility. Parents should be there and make sure that they are adequately supporting their children. Yes, you might come from a very humble or poor background, but do you have a farm that you harvest from? Do you harvest cocoyams? Do you harvest corn? Do you harvest groundnuts? Do you harvest cassava or whatever? When you go to sell those things, remember that there is a child who needs equity, fairness in your home.
Yes, I would like us now to look at this even as we are about to be wrapping up the program, because it is almost time. Yes, Doc, she's just talked about what can be put in place to ensure that children enjoy their childhood.
Yes.
And parents also bring them up.
I would just emphasize the family responsibility, like the immediate family. Even in homes that have just maybe single parents, the best can be done for the child. There are basic things that you should do. And the first thing you should know is, remember the child. Remember that this child is a child. Remember that he has a big role to play in the society. So do everything you can to make sure that these children are not subjected to label, but they are grown up, respectfully and in a way that they can become the best. Frequently take the child to the hospital for even well checkups. Why not? Yes, it's not a child that is sick that needs to be taken care of. Let alone for a child being sick and you take him to, take herbs or traditional medications and so on. No. Bring the child to the hospital for proper examination. I bet you if the child who is healthy is brought, it will be less costly, because disease will be easily identified and treated, rather than allowing the child to get into chronic states before you're struggling to rehabilitate. It's going to be more dangerous. So parents should know that it is their role. The Bible says, train up a child in the way he should go. And when he is old, he will not depart from it. Not the way you want the child to go, but the way that he should go. Understanding their talents, understanding their makeup, understanding their interests in life, and guiding them with biblical principles in order to enable them to make informed decisions when they grow up. That's what
I like that. Can I consider that as your final advice to parents during this holiday? Because that was going to be my last question. Can I consider it as such, or you have something to add?
I think that the issue of child labor, child abuse is a very big concern. If you're on the media these days, you realize that a lot is going on. The law is not sleeping on that aspect. And if you are a victim, even unknowingly, or because of this program you heard us talk about it, please, you need to sit up. Know that the law is after you. Know that eyes are upon you if you do not sit up. So even if you've been doing that going scot-free, know that things have changed.
There is always a time.
There is always a time. So let us sit up and make sure these children grow up in the fear of God.
Your own advice?
Yeah, I think Doctor was talking about the perpetrator, not the victim. Sit up because the law is against you.
Exactly.
So what I would tell parents to do is be in the life of your child. It can be one child, it can be two children. Be in the life of your child, especially during these holidays. Some parents will choose to send their children back to holiday classes. Me, I don't want to advise any parents to do that. There are lots and lots of skills, lots and lots of different traits. A child wants to become something. Think about that thing and help the child start practicing it before they grow up. So you can put your child to learn some hands-on skills to enhance their how do I call it, their abilities, so that they can be able to pick on something to be more productive.
Exactly.
It will drive the innate tendencies, the innate propensities in children, so that it can help the child to explore the world or to explore what they want to become better. So be in the life of the child, know where your child is at what time, know who they are with at what time, know what they are doing and with who, what are they doing on their phones. You want to have time to debrief with your child every day to know how was their day like. You can share your own experiences, and your child will be able to embrace that opportunity to know that they belong together with their families. But if you're that kind of a parent that you leave at 5 a.m., you are already out, and you're coming back maybe at 6 p.m. or later, that you don't even know what is happening in the life of your child, and that's a problem.
Exactly.
Approximately 138 million children globally are subjected to child labor, with 54 million trapped in hazardous work that directly endangers their physical and mental development. Early exposure to adult labor causes severe long-term bodily harm and chronic conditions that persist into childhood. We have the immediate physical toll that weighs on the children. We've listened to our guest today talk about musculoskeletal damage that also affects the children, toxic exposure, trauma and injury, long-term health outcomes, systemic diseases, adulthood manifestations of everything that happened when they were still young, mental and psychosocial impact, especially in cognitive impairment and mental health crisis. So those are some of the things that we don't see happening when we are involving our children in child labor. So today we are saying we should control the way we give work to our children, and especially during this holiday period, our children should do what they are capable doing, and they should also do what actually suits their respective ages. This is the program Health and Beyond, produced by the Communication Unit of the Cameroon Baptist Convention Health Services. For presentation today, my name is Clementine Anjang-Young, and we've been in the company of
Sono Josephine alias Josephel
and
Yemlu Napoleon Gafi.
thank you for being with us, and stay tuned to subsequent editions. Thank you. It's been the program Health and Beyond, where we have up-close interviews with professionals in the health sector to enlighten communities on health-related issues, as well as other topical issues beyond health. The program comes face-to-face with people who have valuable information for public consumption. Thank you for being with us.